Very interesting here. More children are being diagnosed as obese in the last 2 years during the pandemic, and often doctors work with families to control food portions and, when needed, recommended counseling.
Well, now updated guidelines from the American Academy of Pediatrics recommends the use of medication or surgery. Queen City News reporter Will Lewis joins us now live from the Elizabeth area. And Will, a doctor you spoke with, says just because it's recommended by the AAAP, the traditional method should still be used.
That's right, Brian. You know, this is the first time that the American Academy of Pediatrics has updated their guidelines in 15 years. Now, doctors say that medicine shouldn't be the first line of defense when treating children diagnosed with obesity, but they say it is another tool to help their young patients.
Obesity rates are increasing all over the world. 19%, or about 14.7 children and adolescents, are obese, according to the CDC. Health professionals say the physical effects of the extra weight takes longer than the mental toll on some children because of bullying and other social issues.
There's the emotional and kind of psychosocial impacts that are arguably even bigger and definitely more immediate for the kid.
For a child to be considered obese, they must be over the 95th percentile of the body mass index, which is a percentage measurement of height and weight. For the last 15 years, doctors have helped with changing meal portion sizes and recommending therapy to children. Updated guidelines from the American Academy of Pediatrics recommends the use of weight loss medicine and possibly bariatric surgery for children as young as 13.
I don't think anyone's in a rush to say like, oh, obesity, here, just take this medicine and it makes it all better. That's not really how those obesity medicines work.
Some pediatricians say this should be the last resort if traditional measures are not working, and surgery only in severe cases. Also, some drugs are not even approved for teens.
This set of guidelines is a little bit more aggressive in saying we really should think about using medicines that might help, or at least consider it and discuss that with the family.
Doctors say the best time to discuss the issues is during a yearly exam. There also needs to be a talk about children not being as active and changing dietary habits, but it needs to be a family goal.
Kids are supposed to grow. So, your goal might not be no weight gain, right? Your goal might be, let's just slow it down a little bit.
Now, once again, doctors say that medicine will not be a quick fix to childhood obesity. And they say if they are even thinking about prescribing medicine, that decision needs to be made between the child, the parents, and themselves. We're live in the Elizabeth area. Will Lewis, Queen City News.